The July 13th shooting of former U.S. President Donald Trump left U.S. Surgeon General Dr. Vivek Murthy horrified, he told the Associated Press.
We lose nearly 50,000 lives every year to gun violence. My hope is that we can shift from looking at it as a polarizing and political issue and see it for what it is, which is a public health issue that affects all of us.
Last month, Murthy's office issued the first ever advisory on firearm violence. He noted that 54% of Americans have experienced gun violence either directly or through a family member, and suggested approaches to address what he deems a public health crisis.
This includes implementing community violence prevention programs and firearm risk reduction strategies, improving access to mental health care for those exposed to or at risk for firearm violence.
The pro-gun National Rifle Association told VOA in a statement that it is, quote, an extension of the Biden administration's war on law-abiding gun owners. Amy Swearer with the conservative research group Heritage Foundation shared similar views.
Progressive liberal policies are simply failing to protect the public. They're failing to enforce the laws that already exist. They're routinely just churning out the same small subset of the population that is overwhelmingly responsible for the vast majority of violent crimes. And they just keep churning them out instead of putting them in prison.
VOA asked several American voters whether the attempt on Trump's life changed their perspectives on gun possession.
I think if you know how to handle one safely, that you should get one. And now with the climate as it is, I think more people should look at arming themselves and protecting their homes.
There's too much violence in America, and we need to be more specific about our gun control. I don't like to see anyone get hurt.
Researchers say beyond the critical but difficult national conversations on policy, there are measures that can be taken at the grassroots level to prevent firearm-related deaths, most of which were suicides in 2022.
Teaching ourselves suicide prevention skills, being unafraid to reach out to people and have difficult conversations, right? Building structures to report care and concern, and then people to connect and create intervention plans.
Schools, workplaces, faith, and community centers could all participate in those efforts, Peterson pointed out. Veronica Valderas Iglesias, VOA News, Washington.